All right, guys, I'm Michael Allen, TravelCostaRicaNow.com. We're back with Dr. Ariel Ortiz. All right, now this is going to be shorter. We did another video with Dr. Ortiz, and we got way deeper, talked about what he does, we're in his hospital right now, the International Institute of Metabolic Medicine. Is that correct?
Yes, sir.
You're the main man behind that?
You got it.
I am going to say something real quick. Now, just real quick, if you haven't checked out that video yet, he's been on Oprah, he's been on Larry King, he's been on Good Morning America, and you do not get on those shows unless you're an innovator, an inventor, top of your field, which he is. So now he's on Travel Costa Rica Now. He's doing us a huge favor. He's very informative. But this time we're going to be talking something a little bit more specific. Let me go back real quick. If you want to see that video, it's going to be in the description. It's about a 35-minute video. Very informative if you're looking at medical dental tourism. We are in Tijuana, Mexico. Michael, you're Costa Rica. Why are you in Tijuana, Mexico? Because our guy that we use in Costa Rica, our guru, our medical tourism guru, Johnny, who handholds you, who helps you with getting the good doctors for liposuction, stem cell therapy, hip replacement, dental implants, all that also works in Mexico, and Johnny works with Dr. Ariel Ortiz as well. And we wanted to offer you guys other options, and Mexico's a great option. Okay, I am so done with that whole conversation. So thank you very much. Now, we're going to be talking about something a little bit more specific. As a layperson, D'Angelo and I came into Tijuana, Mexico, and we kind of noticed it. There's, I don't know, 7,000 hospitals on one corner or something like that.
there's in 1 square kilometer, there's 1,000 right here where we're at, 1,000 offerings in medical care.
Okay, so that begs the question a little bit. Now, for anybody that does know, I mean, medical dental tourism is huge in Mexico, and it is at the top of the field. You guys are kind of the cream of the crop for good reason.
It is #1 globally here in Tijuana.
I mean, you guys have been 10, 15 years ahead of most other countries in innovation and getting things, doing things. And I think other countries look at you guys as
and that's really a positive aspect of it, but you have also the unfortunate negative aspect that we are neighbors here in Tijuana, Mexico, to the United States, which has a really, let's say, inefficient healthcare system.
Now, the issues we're going to talk about, is it, which you guys will hear in a minute, is it just indicative of Tijuana because you're right across the border, or is this kind of a Mexico problem with the whole? There's bad actors. I'm just going to go with that. It seems to be like with so many hospitals, it seems that there might be some bad actors in this field of tourism, medical dental tourism. Is that a fair statement?
There's a lot of them, and I would say it's the grand majority. I'm going to start by saying...
Wait, say that again. You say
it's the grand majority, really. I mean, I would say that the grand majority of the organizations competing for health tourism do not or have not risen to the standards that the patient deserves, period. And I'll say it bluntly. I'm also going to say it. We are the institute. We are the gold standard of health tourism. Nobody comes close. And I did it because of the love of what I do, of the respect out to my colleagues in the US and everywhere else where patients are coming from.
So you have ties with...
I've got very good friends. In fact, we're partners with the University of California, San Diego. We're a Mexican hospital with a partnership, a bilateral collaboration partnership with the University of California and UC Regents, the whole UC system.
Just real quick, when you say partnership, what exactly does that mean? You share patients, you share information, you share education. I mean, what's that actually mean?
So it means that we share a partnership where education, we share the information, we share innovation, and we do it in a bilateral form. Surgeons from the US come down here and participate in education and in research, and we do the same going up to the States. And in the near future, we're working on a full partnership where we're also sharing patients.
That is so cool. And just so you guys, so we were waiting around a little bit for a couple minutes. He was upstairs doing surgery in front of 25,000 people on a, you have a web program you do, educational purposes.
Correct.
People can actually watch you do what you do, and I'm sure that's, I'm sure in San Diego they're watching.
Yeah, we have an organization where it's basically the most viewed academic online series globally, and it's called the IBC Oxford University webinar series, and we have over 3 million unique downloads at this point, and we're an educational platform, and I'm the global director of communications. And I'll give you an example. If there's this new device, well, we get the author that invented it or created it, and he's on the interview. Or if there's this new procedure, we get the 2-3 guys that are doing it, and then we help others understand more deeply the science and the art form of surgery. And academics is a very important part of the equation to find excellence in any provider.
And to keep this going. I got a good idea for you, Dr. Ortiz. Next time you're like, cutting something with the skin or something, just go, hey, travelcostaricanow.com is a really good...
I gotta say, look, Travel Costa Rica Now, I gotta congratulate you, because you guys have not missed the point. At the end of the day, it's about quality and safety when you're talking about healthcare. And if you miss that point, then you're just in it for the business and for the quick money. And you guys are all about researching who you're going to be recommending. And when you're doing that, you're giving the patient the highest standard of care, which is excellence in medicine and safety.
Right.
And that's what every patient deserves.
Well, thank you for that. And that's why we're talking about this. So that follows. Let's go back to the 10,000, did I say 10,000 or 7,000 hospitals on each corner? Because again, Mexico is the cream of the crop in the medical dental tourism, but the ugly side of it is this. And I just want to talk about that part of it as a warning to folks that are maybe Googling where to get their plastic surgery or their tummy tuck or whatever they're doing, and maybe some of the issues that are kind of, I don't know, if they're not unique to Mexico by any means, but some of the things that they maybe should look out for. And some of the things we were talking about yesterday, that whole supply and the quality control. And then I got a specific question I want to ask you, because I had an interesting experience last night that I wanted to ask you about. But if you could kind of speak to kind of some of those issues as a warning to folks.
Well, you want to break it down. When somebody is looking for care outside their country and it's related to medical, well, nobody really is an expert. And so how do you become an expert? You're going to go online and look for a website? Well, everybody's going to self-promote. Everybody's the #1 in the world. So nobody's going to say, we've got a crappy outfit.
Yeah, don't come here.
Don't come here, we're terrible. We're going to lie about everything. So then who do you rely on? And we spoke about that on the previous video, but ultimately, you really want to rely on experts. And that's why there's accreditations. There's this golden seal that says, you're Joint Commission accredited, and that's basically saying that you've been vetted by the highest authority globally, and you've been given the 5 stars.
And it is a global...
It is global. It is global, and there's over 800 hospitals now that have been accredited globally. But if, say for instance, if you are in the United States and you want to become a hospital that's earning a good amount of money, getting patients and getting paid by the insurance carriers, etc., you have to be. It's an obligation. If you don't have that accreditation, you can't participate in that business. And I believe it should be that same way internationally, but it isn't. It's voluntary. So I have 5 world-class accreditations. Nobody comes close. That's why we're the global standard, the gold standard in healthcare for health tourism, but it's voluntary. I had to say, I want to be accredited, and then they come down here and they look at everything.
All the cracks, all the...
everything, even your underwear, right? And at the end of the day, if you pass, you got to pass with a perfect score, and if you don't, you don't.
Now, do they give you, just out of curiosity, do they go, now, doctor, if you fix this, this, and this, we'll come back in 6 months and do it?
That's exactly what they do. So they give you a fighting chance. In medicine, it's all about improvement. So you can't be
corrective
static.
feedback. kind of.
And this is wrong. You can, and you're always improving. But going back to these things that have to be analyzed by somebody who's not an expert, who's looking outside the country for medical care, well, it's going to be really difficult, but I'm going to help you break it down. You got to look at the doctor or doctors you are thinking of going to. That's called the practice. So the medical practice, right? You got to look at the institution or the physical building where it's going. And you got to look at their academics. In other words, are they really who they say they are? So when somebody is looking out for themselves and saying, all right, I'm going to select the best destination possible, please don't do it with price. That's the stupidest thing you can do. Everybody's going to compete with price. You want people that are competing with quality. So that's going to remove 70 to 80% of your probable prospects.
But I don't know. You say that, and we all know it's true. But for some reason, they go, "Well, I can kind of. They're doing it for cheaper." And they almost are willing to take the risk with their body. I don't understand that.
It's hope. It's hope.
Yes,
because when you're in a country where you can't expense it out of pocket or it's not covered by insurance, and you find a destination, you don't want anything to interfere with that. So it's like, oh, but it looks like a rusty knife, but you know what? It's got to be.
That's probably just that one knife. They probably have better knives.
It's so, and I can't blame the patient because hope is a unique thing, and I wish all my patients were as hopeful as those that end up in the wrong places. But there has to be at least a little bit due diligence, and the due diligence is go online and type the outfit's name or the hospital's name or the doctor's name, and you'll be surprised.
And what you can find out.
Oh,
good and bad.
Good and bad. This is the era of where everything's transparent. Right. You can find anything about anybody, anywhere by Googling them.
So, sorry for probably a stupid question. So, is the hospital getting accredited or the doctors are getting accredited? How's that work? Because if the hospital's getting accredited, well, that means that represents any doctors that work in that hospital. So when the accreditation people, are they looking at all the doctors that work there? Or do they go, I want to see your list?
Exactly. They look at everything. So when you get accredited, say for instance, Joint Commission comes over from the US, they're a US company. We pay them to come over, but we don't pay them to accredit us because they are tough, hard asses. And they're going to look at everything, and they're going to look at including the facilities. They're going to look at the equipment. They're going to look at our processes from start to finish. They're going to look at our doctors, our staff. They look at our software. They look at 3,200 different variables. And if you do not comply with one, you're out. Now, is that better than going to a place that says, oh, we're cheap? Of course it is. Come on. It's like cheap equals bad outcomes in medicine. And if you're scared of those, don't go cheap. Don't use price. Yes, there's affordable.
Because you can always beat a price.
Yeah.
I could call a doctor and go, can you beat this price? Yes, I can. You're always going to say yes.
Well, that's got to be a great test. If you call that doctor and you ask them to beat a price, and if they do, I'd be weary about going there. There's an associated cost to quality, and I can't diminish the price of having experts here, people that studied, people that are doing have the right equipment, that are actually doing tests that are valid, that bring in the sterile stuff that I'm using in surgery. There's an associated cost to performing a procedure, and you can't remove that. And we're talking about cutting corners.
Yeah, but what scares me is since I do see so many hospitals here, maybe it's all around Mexico, but in Tijuana, obviously there's some people not doing their due diligence, because if there was no a demand, there wouldn't be the supply of scammers and bad actors and people willing to, I don't know, gringo price the gringo, or there's obviously a lot of people coming over and just blind faith, hoping that everything works out.
Yeah, and you know what? That the demand is there because we're in the border town, and there's been in the news, constant news, that Tijuana is the capital of health tourism in the world. So basically everybody wants in, and there's big investment, big money, big hospitals coming in where we're partners. because we're going to help them get up to those very high standards of quality and safety. And then there's the other ones that want a piece of the pie, but they're not willing to compete with quality. So what are they competing? They're going to end up opening these hospitals that have low price everywhere.
Well, thank you for bringing that up. Thank you for segueing right into my question. So we were touring a hospital that's slated to open, it sounds like the end of this month. 7 stories, it looks, recovery room, ICU, I mean, showing us all the stuff. By the elevator, they literally had little signs that said, Más Barato. I'm like, so a hospital literally, instead of going, having a slogan that says patient first or something like that, no, we're cheap. And I kind of asked the question delicately, because they had they had all their specialties, like plastic surgery, trauma, blah, blah, blah. And it was like all set price, like $500 for each. Just check the box you need. And they but quality doesn't suffer. Now, I'm doing some math on that in my head. Something's wrong. Something is definitely wrong. And so I wanted to ask you, what's going on there? Because I'm assuming that's what a lot of them are doing. It is price. They know that people do look at just price because their whole thing is forget the patient. We're not even going to have that slogan. Cheap. And this was a big hospital. It wasn't just a little clinic or urgent care trying to get some business. This is looks like a legitimate. It smelled like a hospital, looked like a hospital, sounded like a hospital, but I'm thinking, something's going on here.
I'm glad we don't look like a hospital. Somebody told me we look like a modern airport or something like that.
Well, your stuff looks like spaceship stuff. Your recovery rooms and stuff.
I was chomping on the bit to show off my studio. That was like, oh, look at this part. Anyways, let's go back. He's got a studio that would put NBC on steroids. Oh my gosh, it was so impressive. There's cutting corners at every level. And when there is price, and it's very unethical price wars, when price competition happens, everybody's trying to cut corners and end up with the patient. So what do? They cut corners at every level. So you're obviously not going to get the pre-care or the aftercare, which is extremely important in many surgeries.
Yeah, I would think, yes.
So number 2, especially when we're talking about surgeries, number 2, you're not going to get the quality products. And if it's a tooth, well, maybe it's a veneer or something like that. But again, quality equals durability, right? So you're going to be on the plane and lose a tooth. And those are the small examples. But then you can go into the surgical realm, and that's where cutting corners really costs. You're either not using the right anesthetics, because anesthetics can be very expensive, antibiotics, sterile equipment, reusable equipment, disposable equipment. All right, all that makes you nervous. But what about the staff, the training of the staff, the proficiency of the staff, including the experts that are actually supposed to be experts doing the procedure? There has to be an equivalent between cutting corners and the quality of those actors working on that patient. And it is. When you find a low budget center offering surgery, usually they're going to find the dumbest so-called experts that are willing to work for peanuts. And
the prostitute, there's no services.
You're going to end up being hurt by a combination of everything can go wrong. It will go wrong. And that's the unfortunate fact that when you go back and analyze the reputation of a destination, it's like, oh, it's terrible down there. Well, it's terrible down there because it all started with this price competition and patients fell for their...
I could see how people could be faked out because you walk in, it smelled like everything was hospital. And I can see why people would go, oh, well, they're just trying to offer better, for cheaper for people like me that aren't rich. And I got this amount of money and they're just being nice to me. And I can see how people kind of, like you said, the hope. You kind of like, oh, I didn't see that. That said 1977 on that X-ray machine.
There was someone in the industry that said that criticized us because our standards were too high and we were exaggerating.
I would accept that criticism any day.
It's like, really? It's like if it's my mom or my family member, I wouldn't want less than the best. If it was me, It was my wife. So why doesn't why don't these people think that everybody deserves that quality? In medicine, there is no medium, shortcuts, or 3/4. It has to be perfect all the time.
Can you see telling your wife, honey, you can get that breast augmentation. I found it for $250.
Well, I mean, the worst one I've heard is like, Doc, but I only have half the money, so we'll just do one breast implant, and when we have the other half, we'll give you the other one.
So to combat that, I mean, it's an issue here that I don't know how it can be combated on a overall. I guess you can only do it one person at a time or something, or these type of videos or the stuff you do, and you just hope that people catch on, because it can go really bad, really south very quickly, and you're in another country. What's your recourse on this? This $500 half a breast thing.
This is not going to be regulated by the government, and this is not going to be auto-regulated either, because everybody's going to find the opportunity to make a quick buck. All these organizations, unethical organizations. Ultimately, what you have to do is create a higher standard, and it's not just about us. I've partnered with several large hospitals here in Mexico that are being built as we speak, and I'm going to help them raise the standard. So ultimately, when you have a network of providers that have a higher standard, it kind of removes that other noise from there, and you say, oh, that's the standard I deserve. Once you have that publicly, openly, online, accessible to everyone, then when you look at the lower standard, you're like, I wouldn't go there. Why would people go there?
Right.
Oh yeah, but it's cheap. It's like, yeah, but all these other ones have an affordable cost, but they're not dirt cheap, and they give me so much more, so much peace of mind. And you were saying, like, when you have peace of mind after you look at something, then you're in the right track. And most patients don't end up with peace of mind when they're looking at these cheap outfits. Scary, isn't it?
Yes, it kind of is. So is it just looking for accreditation, basically? I mean, is that kind of, if you don't do anything, at the very least, look for some sort of accreditation on it?
I would say that that's the most difficult one, because they're few and far apart. The culture of accreditation will slowly grow in our region, but we're the only accredited hospital in northern Mexico.
Am I assuming, I mean, maybe I'm wrong on this, I'm assuming that most of these places are geared towards the gringo. Or the,
oh yeah, they are.
Or the, I mean,
they are.
This is not local. I mean,
no, not at all.
I think I asked that question to the same hospital I'm talking about, and they said, no, we're geared toward, but I'm assuming most of this, since it is a medical dental tourism destination, that almost everything's, geared toward the gringo.
It's the U.S. that's coming into Mexico, bringing dollars, paying out of pocket. There's this huge culture also that, well, if you get paid cash, well, you don't have to declare it, right? So it's a combination of things that's happening. Yes, they're running from a system that's kind of broken, which is a U.S. healthcare system.
Kind of broken.
Yeah, extremely unaffordable, not covered by insurance. So ultimately, they come to Mexico, and they're trying to find a better option, a cheaper option. I would like to say higher quality and a safer option, but it's not necessarily the case. And that's what's created this influx of patients looking for options in the different specialties. The most sought after are dental, plastic surgery, bariatric surgery, cosmetic medicine, all the injectables and stuff like that, and orthopedics. And these are all mostly ambulatory surgeries. So that's why these hospitals have investments that are coming in and trying to grab a piece of that action, a piece of the pie. And again, the only way to do it is with quality. You guys very respectfully are looking for quality, because it ultimately is the quality equals safety. If you have quality, you have safety. And if you, as an organization, look for physicians that offer that, you're never going to have trouble. You're always going to be recommended, oh, I found them there and they referred us and we're so happy. And it's just a cascade of goodness that happens in the industry.
It's just strangely ironic. People are looking for cheaper. Okay, even Costa Rica, Mexico seems to be generally cheaper than Costa Rica even. which
Oh, wow.
which is like a third of the price of the United States. Okay, this harkens back. I had a garage sale when I was leaving my house. We were leaving our house. We were moving, and we were literally giving away, coffee cups for 25 cents. And somebody goes, I'll give you 10 cents for it. It's like, so my point is, I just don't, it's already cheap. It's already cheap. What the hell are you trying to do? It's like you're trying to negotiate something that's already a good cost.
Don't push it. Don't push it. It's like, I love the example. If you found something affordable, why go cheap? There's no reason.
I don't get it. Guys, this video is purely for you guys as a warning. If you're thinking about medical dental tourism, do your homework, do your research, and don't cut corners. And just because something's cheaper, it's like a bad pizza that's $2. Come on, man.
I love his examples.
So if you guys are interested in medical dental tourism, whether it's in Costa Rica or Mexico, both have some advantages and disadvantages. You can, in the description, we'll have all the links. We'll have his links. He's got a lot of interesting stuff. And if you want to catch his next surgery next week, maybe, I don't know. All that stuff will be in the description. But again, do your homework, do your research. Take some responsibility, for God's sake. Anyway, guys, I'm Michael Allen. Thank you so much. Really
My
appreciate
pleasure.
it. Great information. TravelCostaRicaNow.com. Things are going to pop up. Always do your homework and research if you're thinking about living or traveling anywhere, and especially if you're doing something with your body. And I'm going to put our videos up with anybody. So anyway, guys, peace.